All right, so before we get going, what I want to do here is just firstly show you how you're going to learn trigger point therapy the easy way in my course, because it is a completely different way than you would normally learn from a book or on a trigger point website or another trigger point course, for example. So what I'm going to do is show you a completely different way that takes away first of all, how would you normally, if you did a trigger point course or book or what have you, how would you be normally taught? Right. Well, there's one way, and that is through the symptoms. So you'll look at the person's symptoms, or maybe it's your own. So it could be shin splints, pain at the top of the foot, big toe pain, pain at the side of the ankle, weakness, stiffness. And so you look at that, and then you'll be given a list of muscles to remember. Not only remember which muscles they are, you have to remember which muscles, where their trigger points are, where the referral zones are, and then somehow remember all of them for all of these different conditions. That ain't happening, all right? Look at dorsal foot pain, for example. How on earth are you going to remember that? Now, you might remember it today, but how often are you going to see someone with dorsal foot pain? Might see one in 8 months. Are you going to remember those? No, you are not, okay? So that is number one way, and that is the way we're not going to teach you. So what's the number two way? Well, number two way is you press on the muscles, and that will tell you the trigger points and the referral patterns. Okay, well, what's the point of that? I mean, unless you know the muscles, but when we're talking lower legs, you've got, different types of muscles as you're about to see in the lower leg, and at the back there's 6 muscles of the posterior calf, and how are you going to remember that? And how are you going to know which ones are which? So that doesn't make sense either, does it? So what is the alternative? That's what I'm going to teach you in this course. Okay, so let's have a look at the back of the leg, the posterior aspect of the leg. In other words, calf muscles, calf pain, Achilles tendonitis, Achilles pain. Remember, when we talk about pain, we can also talk about stiffness. Remember, both active and latent trigger points can create stiffness. Active creates pain and stiffness, but both of them can create stiffness, which can lead to injury. So once again, don't forget, yes, think painful conditions, but don't forget the people with tight calves or stiffness, or they're athletes, or they're sprinters, or they want to lift more weight, and all these sorts of things, performance enhancing as well. So don't forget about that. Right, so, okay, we've got 4 compartments in the lower leg. There's the front, the anterior compartment, which we've addressed, and the lateral, the peroneals. They're the anterior and lateral. Now we've got the posterior. So we've got a superficial posterior bunch of muscles and deep posterior muscles in the back of the leg, okay? So once again, I've been given, I look at this and there's all of these muscles that you're going to try and to remember, and you're not going to remember. There's 1% of you watching this that are really into trigger points and you want to memorize, but I will pretty much guarantee you. Now, first of all, 99% of us just want to use trigger point therapy to have better results on ourselves and on our clients. Because if you start next month learning gua sha or cupping or kinesio tape or fill in the blank, you're not going to remember these. That's why, as I said to you before, one of my biggest problems. So I'm going to fix this once again with this. I'm going to simplify it enormously for you, because I look at the list of muscles and go, which ones were they again? All right. So in a month when someone, or 6 weeks, someone comes with plantar fasciitis or Achilles tendonitis, you'll be going, oh, now, what was that in the list? And I've got to go to my Udemy app. No, forget it. You're not going to learn that way with me. Right. So, okay, let's just think about this. We've got a superficial and a posterior compartment at the back, okay? So you've got, first of all, the most superior is, superficial, I beg your pardon, not superior, superficial is your gastrocnemius. Then deep to that, underneath it, is the soleus, okay? So then there's another muscle, the plantaris, but we're not looking at that. But they're in the superficial group. Then we've got the deep posterior group. So you've got your these hallucis digitorums, this, that. Well, who cares? Who cares? Because here's the thing. How many of you, myself included, think that you can go in there with your list of muscles and try and find through the gastrocs, through the soleus, and try and find tibialis posterior, and know that that's tibialis posterior as opposed to another one of those deep posterior muscles? Okay, so it's no use to you, is it? Because you can't be guaranteed that you're on that. So I've got a much better workaround. So what I thought I would do, rather than the list of muscles, then I thought, well, Okay, what I'll do is I'll just have the diagrams where they show the referred pain pattern, and that'd be even better. But then I'm still doing all of these different images for you, which is better than the list of just the names, because then you've got nothing, no visual image. But then I thought, wait a minute, there's a much better way to do it. There's a pattern. If you look, okay, so let's start off with it. The upper calf pain, all right? So if you look at the list would be gastrocnemius and soleus, okay? Now, these are the top ones, right up the top of the calf, right? So those ones refer locally. So you don't need to know the list. You just know, okay, calf pain up around these, if someone's up around there, they're going to be local points. Right. But then if you start looking at the trigger points and their referral zones, okay, nearly all of them are from the midline medially, because the pain comes down medially or posterior, down the Achilles tendon, and then into the arch of the feet, right? So the vast majority are going to be a little further down in the gastrocnemius and then we're going to work from the Achilles medially, but we're going to do both sides. But if you just remembered, okay, so we're just going to scan really from the center and find those tight bands as we go down, right down to the ankle, and you'll see those points there, okay? So you go right down, so you can see the soleus one, really highly indicated for heel pain and Achilles tendon. But that's down here. So there's really not that much room that you have to work. But we will work through those, and I'm going to show you how to do that. But if you just simplified this for yourself, okay, you look at the diagrams, and you can just work out. You don't have to remember these muscles. Just know that if we go scanning through all of these, we're going to hit certain tight bands. And if those tight bands can be referring to these areas, that's all you need to. So let's go scanning through the calf, just working right the way through as you go through. So you do not have to remember the muscles, okay? It's not necessary. And two, I doubt that the vast majority, including myself, have any idea which muscle you would be on, whether it's a tight fiber of the gastroc or deeper to the soleus or deeper to the deep posterior muscles. Which one are you on? Really, anyone's guess. All right, so what I want to do is show you how to treat this on yourself, or if you've got a client and you're treating them, this is something they can do between treatments by doing some home treatments, okay, some techniques. Right, so let's go through this. Now, like I said to you earlier, what we're going to do is we're going to hit everything, right? But what we're going to do, we're going to have a methodical approach, whether we're treating people, like clients, massage clients, or treating yourself. And so what we're going to do here, I'll just come back a bit. So what you want to do here, you can put your leg across here, you can have your leg up on a chair to work like this, whatever works for you. You can even have it like this, depending on how flexible your hips are and that sort of thing, okay? But the point is what we're going to do, we're going to start in the center of the gastrocnemius, okay? Right in the center there, between the two heads of the gastrocs. Right, and what we're going to do, you can start off like your thumbs like this, if that's, or you can have them one over. We're not putting much pressure on at the moment. So what we're doing, you know the muscles go like along the tibia, lengthways like that. We want to go across to find those tight fibers, and then once we find those tight fibers, we want to find the trigger points. So start up the top here. So we're going to work from the center of the gastrocs and start working across to start for, again, these can be sensitive as you start, so just go gently to start with, because we're going to start working the gastrocnemius, then we'll start working just a little bit deeper into the soleus, and then we go into the deep posterior muscles. Now, we'll get to this, but you access them basically going into the center between the gastrocs, and then you'll go medially like I'm doing now, so we go deep, and then the other ones we can get by going straight to the center again, but we're going to work out laterally. So if I put my leg up here in the center, okay, and then I'll go across laterally, and if you're deep into there, you get to the tibialis posterior and these deep posterior muscles. So it's not, so what I want to say to you is just, now, by the way, you can use oil or creams, that sort of thing, but you really don't need to. That's just better, because then you can do this anywhere, watching TV, there's no mess or anything like that. If you want to use oils or creams, by all means you can. So starting at the front, and we're going to go across, and see if you can feel, just gentle pressure, see if you can feel those tight bands. And what you want to do, of course I'm feeling them all through here, right here. Now remember, again, calves, if you or someone's got a history of deep vein thrombosis, you've got to check with the doctors and stay off varicose veins, okay? Work around them. So you've got to work your way along here. So we'll start up here and make a methodical approach, medial, as you roll over, starting to find those tight muscles. Do you feel the tight bands of muscles going along here? If you do, like I am, okay, go up and down it a little bit. Try and find that really sensitive spot. Now remember, just at the base of the calf here, we've got the soleus trigger point that refers to the heel and the Achilles tendon. So we'll have a look in there, and there it is there. See if we can go up and down it a little bit. So we're just scanning, and that's it, right there, okay? That's really sensitive on me, and that's about, just below the gastroc head, and just medial to the Achilles tendon here. But again, you don't need to know your anatomy. This just, all you're doing is feeling tight bands and then pressing on right now. Now, interestingly enough, as I press on this, it is referring pain exactly into that heel for me here. Okay? So, work all the way through and then just start going deeper as you start to go to deeper levels. All right? And then you can do the opposite side, okay? And then once you want to go deeper, go into, it's always starting in the center of the gastrocnemius heads, okay? And then just keep working deeper, and then you'll get those deep posterior muscles as you work down. And come all the way down. Now, another way you can do to save your thumbs, so let's say, so I'll put it up here to do the lateral side, right, while I talk. So, you see here, so I'm once again starting at the middle of the gastroc, and then I'm going to roll across the belly of the muscle. And then I go a bit deep. Whew, there. Okay, right there. Right there. And would I know if that's gastrocnemius? I think it probably feels like those upper gastrocnemius fibers. Could it be soleus? Yes, it could be. Does it matter? No, because we're going to work them anyway. And if I go down deeper, then I can start to feel those deeper posterior muscle fibers down there. Right down, okay? So what I was going to say is, so those I've found. So you can use your kneecap, this kneecap, as sort of your massage tool and work around using, just moving that leg about to find, and then just pressing onto them like that is a really great way to do it as well. Great way to save your thumbs. But again, double up your thumbs. You know what to do by now. But that's what you want to do. You start off in the middle and you do medial work. Starting off, just, again, could you use your fingers? Yeah, of course you could. When you find them, could you pop your knuckle onto it? Yes, you could absolutely do that. Okay? So we're going to work all of those as you do that. And then, just like the top of the foot, we have to also address local pain by local trigger points on the underside, the plantar side of the foot. So let's have a look at the ones that can refer pain to the heel and certain parts of the foot, because we want to work these and we also want to work these. So we cross the T's and dot the I's and cover all of our bases. So let's have a look at the foot muscles. Okay, so with that, with the legs done, don't forget the feet. So you can see there are feet in your diagrams. Forget the names, of course. So just remember that they're local points and they refer pretty much locally or a little bit distally. So it's that simple. So someone comes in with heel pain, there'll be that spot there, okay? So generally when there's heel pain, there might be heel and arch pain. So you can see you're just going to work those. So you're just going to work along here and across here. And that'll clear your heel and your arch pain as well. The other ones, well, you can see by the diagram, if the pain's out here, little toe pain, you're going to work along those muscles. Anyway, in this forefoot metatarsal pain, okay, you can just see there. So you're going to work these bands along here, between the toes here, or the metatarsals, I beg your pardon, and just see there's one going across there. So you want to go up like that as well to get it across that's going horizontal. All right, so just to recap, all right, so you've worked someone with plantar fasciitis, heel spur, heel pain, whatever they've got, mid-arch pain, that sort of thing. Just remember, you come down to the feet and you're going to work those in through here as well. Okay, you've already done great massage anyway, but just remember a little more love to these points in case they're maybe had nothing to do with the leg. Maybe it was half and half, maybe it was all coming from here, but just don't forget it. So down here, heel pain, mid-arch pain, you can see those muscles there, inside ankle pain there, okay? And the ones through the midfoot here, so you're just working through here. All right, so just remember, got to treat the foot as well.